Well, it's really a pleasure for me to be here. I consider it a privilege because I have actually interacted with George over 8 years ago when he was just beginning to think about how to really advance the state of the science, the state of translational medicine, the state of treatment in Alzheimer's disease. And over the past 8 years, I have to say, as a witness of advocacy, I have rarely seen something, a movement, come together like this. So, as you know, there may be no more urgent public health challenge facing us than that of Alzheimer's and dementia. Today, more than 45 million people around the world suffer from the disease, and as you've heard, by 2030, it is predicted that almost 75 million people will have dementia. And the challenge to develop new therapies is daunting. Highly accomplished professionals, the Vradenburgs, could have enjoyed retirement, but instead they began their encore careers, and it was born out of their own suffering. And in many cases in advocacy, it comes from a personal experience, a human experience, and that came from caring for Trish's mother, who was struck by Alzheimer's. And George and Trish have made defeating Alzheimer's their life's mission. They have invested their time and energy and smarts and resources to found UsAgainstAlzheimer's in 2010. And I would like to take just a second here to tell you my personal interaction with George. George will call you on your cell phone. I was still an NIH director, and I don't know how he got my cell phone, but he would say, you know, how do we fund Alzheimer's more? And I need to really understand how this works. And George, I think, was somebody who never gave up. And so I would say, look, I don't know, maybe we should talk in the official capacity and really discuss the strategies to do this. And he was a learner. He was learning by talking to so many people how things really worked. What was the system that needed to be put in place to make the fight against Alzheimer's disease succeed? And he realized that you couldn't do it without partnerships. Partnerships of patients, partnerships of researchers, partnerships of government, of academia. And more importantly, recently, he even got into international politics. So I get this call about the G8 initiative in the UK about dementias and Alzheimer's disease, and who's behind it? George and Trish Vradenburg. I said, my God, I escaped to Paris, so I didn't have to deal with this again. And sure enough, I got a call about, co-chairing and maybe helping the G8 initiative and lobbying in France to get France to support it. So this is a personal experience. A lot of people have created organizations, but George and Trish have created a national and international movement. Trish has used her writing skills honed on such TV shows as Designing Women and Family Ties to tell the story of the impact of Alzheimer's on her family through a successful off-Broadway play titled Surviving Grace, whose stage readings across the country, starring Diane Rehm, have raised awareness of the family impact of the disease, something that we physicians don't always understand. The caring family is as affected as the member of the family we're caring for. And this is something that in 5 short years they have accomplished, more than many do in their lifelong career. They have convinced the US government to embrace the national goal of preventing and effectively treating Alzheimer's by 2025. Francis, you have to be ready and work hard. Francis Collins is the person to lead, and with Richard Hodis, my old colleagues at the NIH, no one is better qualified to drive the science in that direction. They help lead the fight, along with many in this audience, to more than double the annual investment by NIH in Alzheimer's since US Against Alzheimer's was founded in 2010. They convened the Global CEO Initiative on Alzheimer's. That was another call that I got from George to get my CEO to be on his advisory. And so, George, again, one more time, your tenacity was something that we at Sanofi supported with Jensen and many others here today, remain members of his CEO initiative to bring industry and governments together to achieve the 2025 goal. And he launched the Global Alzheimer's Platform Foundation to serve as the hub of a pre-competitive private partnership to speed clinical trials and take 2 years off to bring innovative Alzheimer's therapy to those with or at risk of the disease. George and Trish understand that Alzheimer's is a global threat that requires a global solution. And George has been appointed to the World Dementia Council by the British government and has used his leadership and influence to help drive the broader global community to embrace the 2025 goal for finding a treatment for Alzheimer's disease. Nothing is more important than to have global cooperation, because no one knows where the breakthroughs are going to come from that will solve this disease for us. So through the CEO initiative, George has also initiated the Lausanne Dialogues that bring together through a global meeting, the OECD, Alzheimer's Disease International Organization, the Swiss government, to ensure collaboration, align investments, and new pathways for regulatory alignment and patient access. So, in a word, George and Trish truly exemplify the spirit of what can be done by advocacy, intelligent advocacy, that can really bring together all the forces needed to fight the diseases that affect us, affect our parents. My wife, Nadia, had her father pass away from Alzheimer's disease. It's a personal fight. And so this exemplifies the spirit and advocacy exhibited by Research America's Gordon and Lundgren Leadership Award for their tireless dedication to advocacy for Alzheimer's research and treatment. It's really my privilege and my pleasure and honor to present the Gordon and Llura Leadership Award to them tonight. George and Trish.